Suffered from migraine headaches, TMJ, dyslexia, or depression, then this program may be of interest to you.
Hands-on healing. This week, craniosacral therapy with Alix McLaughlin.
We're here today at the Craniotherapy Center in Toronto. I'm speaking with Alix McLaughlin, a craniosacral therapist. She's been in practice for 10 years and is an international workshop trainer. Welcome, Alix.
Thank you.
Thank you for joining us. I understand you've been practicing out of your clinic for about 9 years. Can you tell me a little bit about it?
Yes, the Craniotherapy Center has been operating for 9 years, and we have 4 therapists. I run it with my associate, Robert Harris, and together we are 2 of the 3 Canadian teachers of this work, and we have 2 other therapists that work with us in our practices.
Great. Could you briefly describe to me what craniosacral therapy is?
Yes, craniosacral therapy is a very gentle, hands-on treatment that treats the entire body, but particularly pays attention to releasing restrictions in the cranial bones and the cranial membranes, which are the membranes that surround the brain and spinal cord.
What is the history of craniosacral? How was it developed?
Well, craniosacral therapy is originally an osteopathic technique, and it was developed actually around the turn of the century by an osteopath named William Sutherland. And he looked at the sutures, which are the bones of the skull, and he had been taught that these sutures fused when a child reached about the ages of a teenage, and that the head was just a solid coconut and never really moved again. But he looked at the design of the sutures or the joints and saw that they were different in shape and thought maybe they were designed for motion. So he learned to feel motion on his own head. And he designed himself a helmet made out of the old aviator helmets, and he put on turn screws and clamps and levers, and for 2 years in his osteopathic practice he put pressure into different parts of his cranium, and then he would record all the symptoms he'd go through, and then he had to develop techniques to release these restrictions, and that's how cranial therapy came about.
Can you explain to me how it works exactly?
Well, the treatment is very, very gentle. First of all, the amount of pressure we use is about the weight of a nickel. And so if I were to put my hands on you, you would barely feel my hands. And we detect subtle rhythms through the body. And these rhythms are caused by the craniosacral rhythm. As the head widens and narrows very slightly, we're talking microns, in response to changes in the cerebrospinal fluid, the entire body goes through a motion pattern. And so the craniosacral therapists are trained to feel these sensitive, delicate motions in the body and treat the areas that are unable to move. So we look for restrictions, and then we treat them with gentle, hands-on techniques, particularly paying attention to the mobility of the bones in the head and of the membrane system around the brain and cord. So in fact, we're treating the environment of the central nervous system.
And who comes to you? Who do you treat?
Well, we treat all the way from brand new newborns all the way to the geriatric population.
Wow.
To start with the newborns, when children have had birth traumas, and are either experiencing developmental delays or colic or even difficulty nursing or even restless, irritable babies. Very often it's because they have some compression around their brain caused by the membrane system not being as elastic as it should be. And so we use very gentle forces on these babies to relieve the restrictions, and often in just 1 or 2 treatments can help them come back to normal functioning. As children get older, we treat children for learning disabilities, dyslexia, hyperactivity, behavioral problems. I mean, if you think about it, we're talking about the whole functioning of the brain, and so if there's any abnormal pressures on the brain will be affected, whether it's in personality or cognitive area or in any area. As we get on to adults, we treat a lot of people who are in chronic pain, chronic and acute pain. and we treat for headaches, migraines, back pains, that kind of thing. But we also specifically treat people who have all kinds of neurological problems, who have ringing in the ears or abnormal control of the eye muscles, or facial problems, particularly people who have had head injuries is the most specific area for this work.
Right. And what do the clients feel? What are the sensations they feel during a session?
Well, a lot of people actually don't feel anything because it's so light. It's very, very relaxing. And what they notice is the areas that are in pain start to dissipate. The areas that have pressure in their body or restrictions start to let go and relax. So it's very relaxing, and it's very helpful in reducing their stress levels. And mostly people feel better when they get up off the table. Things have changed, they feel clearer. People say their heads feel less foggy, or their system feels clearer, they're thinking better. The children, sometimes children with learning disabilities, not to say, of course, that every child with learning disabilities will improve with cranial, but we've seen many, many cases where a child, after 1 or 2 sessions, will shift from reading at a grade 1 level to a grade 8 level. It just seems to, once you take the pressure, abnormal pressure off the brain and spinal cord, it just allows the brain to reach its greatest potential.
Oh, wow. Is there any time where you wouldn't treat somebody? Are there any?
There are very few contraindications for craniosacral therapy because it's so gentle. It's one of the lovely things about this work is that you can't do harm with it.
Right.
It's so gentle. There are conditions where we wouldn't work on somebody's head that would be quite obvious, as somebody had a recent skull fracture, somebody's had a recent stroke or bleed in their brain. Obviously we wouldn't want to treat them until that whole system was healed. But after everything's been healed, it's actually a wonderful technique to relieve abnormal scarring in the membrane system or around the brain. So we do treat people who have had brain surgery and are past the recuperative period and are now dealing with whatever symptoms are left over from the surgeries.
So you would consider it a preventative therapy?
Absolutely. Not only does it help people through releasing symptoms, and we really try to find the cause of problems, and I think that's one of the specific things about this work, is really going for the causes of the problems. But once the body's mobile and free and the craniosacral system is moving well, then we notice an improvement in immune function, we notice an improvement in brain function, and we notice a more resilience. Somebody could have a fall, but their body won't hang on to that trauma because it's flexible and able to allow the trauma to move through them.
Right.
It's when areas are greatly restricted and somebody has an accident that those are the areas that really get into trouble.
And how long is the treatment?
Our treatments are generally an hour. There are some therapists who might treat a little less than that, but we find it takes an hour. And one of the unique things about it is that we're asking the body's own self-correcting, self-healing mechanism to take place. So instead of taking something that's tight and stretching it, or something that's out of alignment and putting it back into alignment, we rather support the body's tissues in such a way that their own system can make the correction. And that means change tissue that has scarring in it or adhesions back to normal elasticity. It means releasing restrictions in the bones themselves of the cranium. It means freeing up the membrane system, and this takes time. So sometimes we need to hold a position for a while for the body to release, and that's why the sessions are an hour. But the good news is, once they're released, they're gone. It's not like a muscle that's tense and gets relaxed and will just come back. We're actually getting to the cause of what's making that area tight in the first place. So once they're released, the treatments should stay.
How often do people come to you for treatments?
It depends on the individual and what it is that we're treating them for. Most often people might come once a week or once every 2 weeks until they're better. What we do is we only treat them really as long as their symptoms are improving and until we feel like we've mobilized their system as much as possible. So for some people that may be 1 or 2 treatments, and for somebody else with a head injury who's been in a coma and has a lot of neurological problems, it may be once a week for months and months. But what we do is we just treat as long as we're finding that we're having progress in the results.
Great.